as I get older and have less energy to get on airplanes when crisis happens, I feel a little bit, I don't know if it's a godfather or a grandfather or whatever, but I'm really happy younger people are doing this now, and it makes my life easier. But these are examples of faculty. So we have people who actually have been involved in the nuts and bolts of programs and practice, and here are some examples of that. I've worked under Secretary Clinton as the US government's senior person for children globally. I used to work with UNHCR. Les Roberts, who is I think one of the world's best epidemiologists, worked in the Ebola crisis. He was in Iraq doing mortality studies, showing how mortality rates went up post-invasion as opposed to pre-invasion. Richard Garfield, who is in our department, also the School of Nursing. He's currently seconded to CDC, but he's posted with WHO playing a regional role in the Middle East right now. And Lindsay, whom you met, directs our CPC Learning Network, which is care and protection of children, something that I started about 10 years ago. We also have faculty that play roles, technical assistants. So Rachel Moreski, who teaches courses on communicable disease, for example, interfaces with the Global Health Cluster. Michael Wessels, who's really just a lovely person, developed the SPHERE standards, which is the UN standards on mental health and psychosocial response, et cetera. We work with a lot of agencies, and we're interested sort of in long-term engagement, not just acute responses, but how you move from emergencies to kind of recovery and systems development. And the question earlier, which is how can we use capacity developed here in Turkey when it's time to go home to Syria? Those are issues that we've attempted to understand and make a difference in different parts of the world. So essentially, the program was started in the aftermath of the Rwanda genocide. And one of the things that was learned globally in the response to the genocide in Rwanda was that the international community was not terribly well equipped to deal with the magnitude of those sorts of problems. And after the genocide in Rwanda, a number of things started to happen, which including the establishment of ALNAP, which is an interagency learning group based out of the UK and funded by ODI. And the Mellon Foundation came forward, and they did surveys in universities in the UK and the United States largely, and they found, on the one hand, people that dealt with international relations and global health said, we have these issues covered, semicolon, but they weren't being covered. And so they actually made the decision to invest in a number of universities so you could develop specific curriculum programs and research programs on humanitarian response. So that's kind of how we came into existence. I will say that universities in general have an important role to play, semicolon, but it's like we're not the main stars in this thing. It really is the practitioners and the organizations and the health systems and whatnot that are the frontline workers. But academia has a role to play in terms of supporting technical capacity and in terms, I think, of distilling independently lessons learned. We have been involved in a number of evaluations, for example, of multilateral UN interventions and NGO interventions, when evaluations are sort of, if the money is with the agency and they're evaluating their own program, there's an inherent conflict of interest which becomes difficult. So we do think that academia has a role to play in terms of independently arbitrating and helping to kind of identify what is efficacious practice. And of course, you do that in partnership with people, but I think when you leave it to the agencies that are implementing, it becomes perhaps a more questionable endeavor. At least that's been our experience. So we pursue what we do in 4 ways. We do have a specialized curriculum in humanitarian issues, which we hope to keep it grounded in field realities and research. So the research that Lindsay was talking about that we've done in northern Uganda and Indonesia, other parts, I think one of the things that I'm particularly pleased about is that as a program, we really have come up with courses. There's a course called Field Investigative Methods, which we've really struggled hard to figure out how do you measure difficult and sensitive issues, including human rights violations, including domestic and gender-based violence, including things that people say are difficult at times, impossible to measure. There are informal information networks. For example, in Africa, if you want to find out about domestic violence, you don't go to the police or the UN, but sisters know what happened, neighbors know what happened, and whatnot. So what are those information networks that you tap into to find out about realities? So we offer a degree in public health, and we have a DRPH, a doctorate in public health program in public health and global health and humanitarian systems. The MPH program really is geared towards people who have, 1 or 2 years experience, and they want to, so you've practiced for a while, you realize you know some things, there's other things you don't know, and so you come to get that set of skills that we put forward in public health. And then the DRPH program is more for mid-level people who want to move up to sort of senior leadership positions. Okay. Now, this is a picture of a refugee camp in Haiti in the aftermath of the earthquake down there, which was quite a mess. Haiti is a country in which, certainly compared to Turkey and many countries in the world, doesn't have systems. I mean, at one point the mantra was, let's build back better, and then I think people started working there and they got, gee whiz, there's not a lot to build back from. So it's a country that doesn't necessarily have strong health systems or systems, period. And this was actually where some of the original people who were displaced by the earthquake settled. It's actually on a golf course. And so if you look at this picture and you're imagining you're out as a public health person working for an organization, you should be able to immediately start to identify what some of those key health concerns would be. Would anyone like to render a response? Like when you look at this picture, what would you be concerned about from a public health standpoint? Yes, sir?
The water situation in this place.
Nope.
The water and sanitation.
No water, sanitation. So you're on a hill. You're also in a monsoon part of the world, and it got pretty messy. So sanitation was a major problem, and of course, poor sanitation causes a lot of health problems. Excellent. Anything else? Yeah. Say it again. Shelter. Okay, so this is something that's not going to last very long. Okay. Sorry? Your people are living very close together, which influences the transference of disease. Other things.
Snake, mouse, bites.
Okay. So rodent bites, snake bites, things of this nature. Those are all great. So you've already passed one of our courses here.
And sometimes fires.
Yeah, fires, dangers, depression. Yeah, it would be hard to live here. The other thing I want to emphasize is kind of in the middle of that area up to the left where it tilts up towards that one tree, there was what we sort of call a hidden helper. And what we try to do also in these situations that lack coherence is try to find those people that are part of an informal system that are helping people. And in this case, it was a woman who had taken in, I think, 6, 7, 8 children who had lost their own parents. She had brought them in. She was feeding them, but she was also remarkably, for a couple of hours a day, was getting them together under a tree, getting them to read, getting them to play, etc. And this is sort of this combustible resilience that we're looking for. And you can build a program around these hidden helpers, at least in the early phase. So what we try to do then is not only go through the specifics of, what is malaria and vectors and how do you get it and how do you control for it or whatever, but how do you sort of use ecological thinking and sort of causal mapping to identify these resources that exist everywhere, but we tend to overlook at times. Quick example, just one of the learning modules. We do emphasize the sphere standards because humanitarian workers need some sort of consensus in terms of what are the minimal standards in this way. We want to make sure our people understand that. Can I speak into the microphone? I thought I was. Okay. So we do emphasize the sphere standards, but it'll give you an example of how a particular module in a training on health systems and emergencies is designed. And then if we just sort of look at some of the things I was talking about, disasters don't necessarily affect people equally. There's more vulnerable populations. Ecological thinking and causal mapping, I just discussed in terms of the example on Haiti. And then again, I think that how do you use emergencies, which do tend to attract a lot of money? How do you use the emergency response to start looking at recovery and redevelopment? So those are things that we also stress. And then these are just examples of courses that we offer. And I think basically this graph, this is actually something that Linda Fried wanted me to put in here, but I'm not quite sure why. Essentially, crisis, things go down, but if you are able to respond in a particular way, you should be able to build a system back better. At least that's the goal. There's lots of problems. We don't even have a common definition of what recovery is, but we won't go into that at this point in time. So in summary, we do focus on training humanitarian professionals. We work through other centers and universities. We have a center that we helped co-found in Indonesia, for example, University of Indonesia. We have one at Makerere University in Uganda. And then we're just starting a fledgling program out of our center in Amman, where we're working with UNICEF at the moment to identify health training needs in the MENA region, so Middle East and North Africa. And the idea is we're going to do some face-to-face trainings to begin with, but it's mostly then to create sort of distance learning and interactive training. And we've been talking with our friend from Beirut, possibly anchoring some of this here and whatnot. So it would be creating a tool that could be used potentially within the Middle East, and it's not going to belong to us. It's going to belong to whomever wants to use it. So with that, I will stop.